Welcome to our special call-in show on the coronavirus. I'm Gianna Gelosi.
And I'm Christina Renault. Now, each day, more and more people in the Hudson Valley are learning they have the coronavirus, with the outbreak now spreading to Dutchess and Orange counties.
A majority of the cases remain in Westchester, which has 27 new patients just today. We're here with a special guest to help answer your questions on the outbreak. So we are taking calls right now. The number is 914-378-4610. Now, tonight's guest is Dr. Elaine Healy, who is United Hebrew's medical director and the vice president of medical affairs there.
Good evening, Dr. Healy. Thanks for joining us.
Thank you for inviting me.
First, let's get a check of the numbers. There are now 148 confirmed cases in Westchester, including 6 patients in Yonkers. There are 7 cases in Rockland, 1 in Orange, 1 in Dutchess, and 4 in Ulster County. Again, we want to hear from you. Please call in with your questions and comment. That number is on your screen.
Okay, so Dr. Elaine Healy is answering your questions tonight. She provides medical leadership for United Hebrew's skilled nursing facility in New Rochelle and oversees the overall quality of care. And as we know, the elderly are some of the most vulnerable. So what has your facility been doing to protect that community?
Well, when we first became aware of the outbreak, we immediately implemented our emergency plan to deal with such respiratory infectious outbreaks. It's called the Pandemic Influenza Plan. Even though this isn't influenza, it is a contagious respiratory virus. So we immediately implemented our plan. We started enhanced sanitation. We in-serviced our staff. We started screening visitors for symptoms. But as the outbreak continued, particularly in the New Rochelle area, we became particularly concerned, given that we are a skilled nursing facility right in the middle of that area. So we implemented a non-visitation policy at the end of last week. And we felt that it was important to reduce as much as possible the number of people that were going through the facility so as to reduce the potential exposure of our residents. So that was in place as of the end of last week. And since then, we've continued to scrupulously clean our facility. Our staff has been re-in-serviced on infection control measures, and we very carefully monitor our residents for any signs or symptoms of the illness. All staff are screened before they report to duty. Again, visitation has been virtually eliminated, and we are being very, very careful to monitor the condition of our residents.
I mean, statewide now the governor has announced that all visitation will be suspended for people, you know, at nursing homes, except if that person is in hospice care, end-of-life care. This is crucial, though, that not to bring any new people into these situations, any family members, anyone that might be infected.
Correct. And sadly, I think everyone is aware that probably half, I know there's more fatalities being reported all the time, but the majority of them up to now have occurred in a nursing home in Washington, and now more than one. So we took it very seriously. The nursing home population is vulnerable. The individuals that are receiving care there are by and large elderly, with the average age of around 82. They have multiple health conditions that are occurring at the same time, and they are living in a confined area, in a congregate living situation. So it's particularly challenging to keep infectious illnesses, particularly respiratory illnesses, from entering the facility. So we really felt we needed to proceed with those measures.
All right, thanks, Dr. Healy. Now we do have our first caller. That is Sarah from Yonkers. So Sarah, what would you like to ask? Sarah?
We might have lost Sarah. Sarah? Are you there?
Hi, my question is, there are many people that have not been tested yet or go to the doctor and they're considered having the flu. So they are not being tested for the coronavirus because I know, reading online that they were mentioning that they don't have enough ways of, they don't have enough testing kits available to test them, and they're just saying you have the flu. So adults and children who are being told that they have a flu, you know, we don't know for sure that they have the flu or the coronavirus. Is there a way of finding that out?
Well, it's a good question, and I think unless and until we have both sets of tests, it would be impossible to say that they couldn't coexist or you couldn't have both. But the way we approach it clinically is that if someone presents with a respiratory illness and they test positive for the flu, we consider it to be the flu. We still are in flu season. If it's negative for the flu, and particularly if it's a severe respiratory illness, that's when one would have to consider coronavirus. But having a test positive for the flu is a pretty good likelihood that that's what it is.
Dr. Healy, now we're headed to Larry, Yorktown. How long does it last on surfaces is Larry's question.
Well, I think what we're beginning to learn is that it may last for a few days. And this is the type of information that is emerging on an ongoing basis.
Okay, now we're going to go to Barbara. So Barbara, what would you like to ask?
I live over near Rochelle, and a little concerned because, well, a couple things. Number one, we can't even get our supplies like the hand gel or even like Lysol or the, Clorox to do the surface cleaning. So, and I thought we would be like a priority since we're in a hot zone, but there's everything around here is sold out. So I'm wondering if they know if there's going to be anything expedited for, shipment over to the stores. And my other concern is the people who are quarantined over here due to exposure. Is there any system on how do you monitor that they're actually staying home and not going out? I know there's not a military zone, but I'm just wondering how do they go about monitoring to make sure that people are staying home and that they're not spreading it? I know there's a lot of people still being irresponsible. Thank you. I appreciate your help.
Sure. Well, as you know, the governor has set up, has called in the National Guard, and they have set up an area in which they have been going to operate from. And it is possible, and I believe they're going to be bringing in supplies to this area for distribution. So.
Anything that you would say to residents if supplies are running low for, hand sanitizer, anything that you tell people in general to keep themselves safe?
Well, I think the best thing really is good old-fashioned soap and water. I know that when we go out, that's not always available to us, but certainly try to keep your hands, and it's a little hard because we're used to bringing our hands up to our faces, but soap and water is really the best way to remove germs from the hands, and scrub the hands well, rinse them with water, and that works well. It has since time immemorial.
Right. Now, I know, just to go back to Larry's question, he said, how long does it last on surfaces? There's still so many things we don't know about this, correct?
That's right.
Just how long it may last? I mean, is that another question? I think a lot of people wonder, how long is this going to keep going?
It is a question. It's a good question. And I think that what we have to do is sort of allow ourselves to exist a little bit with some uncertainty about things. We really don't know. It is an evolving situation. And the best thing to do is to practice common sense and to monitor the situation and listen to the advice of the health experts. We are learning things very quickly, but there still is a lot to unfold. So we have to give ourselves a little bit of allowance for some uncertainty, but practicing common sense measures for the health environment is the most important thing.
All right. Now, earlier we sent out our crews to get some questions to ask you, Dr. Healy, and here's the first one.
What do I do to protect myself other than wearing this silly mask?
I'm sorry, I didn't hear that question.
He said, he said, what should he do to protect himself other than wearing what he called a silly mask?
Well, I think what we're being encouraged to do now at this point is, as we've learned from the governor, is to restrict as much as possible being in places where we are commingling with large numbers of people to the degree that you can. And I think it's important to recognize we're not going to be able to reduce our risk to zero, our risk of exposure to zero, but that the more we reduce it, the better off we are both on an individual basis and collectively in terms of a public health reaction. So to the degree that you can perform hand hygiene frequently, not touch things in your environment, keep the hands away from the face and nose. Obviously, if you know people are sick, try to distance yourself from them, and try, as we've all learned, I think it's been reinforced, not to go out in public if you know you're sick. Those are really the kinds of things that are really going to make an impact on a public health level.
Okay, thanks, Dr. Healy. So we're going to take a short break, and we'll be back answering your questions. So keep those questions coming in. You can call our line there. The number's on the bottom of your screen. That's 914-378-4610.
We'll be right back.
Welcome to our special call-in show on the coronavirus. I'm Gianna Gelosi.
And I'm Christina Renault. Now, each day, more and more people in the Hudson Valley are learning they have the coronavirus, with the outbreak now spreading to the other counties.
Now, a majority of the cases remain in Westchester, which has 27 new patients just today. We're here with a special guest to help answer your questions on the outbreak. Now, tonight's show is going to be a lot about nursing homes, so if you do have a family member in a nursing home, or if you have any questions with regards to that, this is the number to call, 914-378-4610. Tonight's guest is Dr. Elaine Healy, who is United Hebrew's Medical Director and the Vice President of Medical Affairs.
So many people have loved ones in nursing homes, obviously concerned that's one of our most vulnerable populations, as we keep hearing from the governor. What do you say to people who are in that position? They have a loved one, a friend, as far as, you know, communication with that resident. Is there anything you can tell them at this point?
Well, what we've done at United Hebrew is several different things. For one thing, we have assigned a recreational therapist to each nursing unit, and that person is proactively reaching out to the family members and arranging for what we call virtual visits. So we're using FaceTime and Skype so that the families can see their loved ones and interact with them. And I think that's gone a long way to assuage the anxiety of a family member who's naturally concerned about the condition of their loved one. And I think just by being able to see them, it goes a long way towards reassuring them. We also have a nurse that's assigned to contact the families and to communicate with them as to the condition of the resident. And very interestingly, I have to say, it's been actually less than a week since the no visitation policy was initiated, but the residents are actually pretty calm, and I am not sensing, and I've asked the nursing staff as well, I'm not sensing an increase in sort of anxiety or agitation among the residents, which is somewhat surprising, a little counterintuitive, but for some reason things seem to be calm, the staff is focused, and I think the people should probably feel better. It's not maybe what one would have expected, but the residents are doing very, very well.
Well, that's good to hear. I know a lot of people have been talking about the sense of community in Westchester that's been developing now. Now, we do have Catherine in Yonkers on the phone. So, Catherine, what was your question?
Yes, thank you for taking my call. I have a question regarding residents that live in very large co-op and condo buildings, especially those that have an elderly population, an extensive one. What preventive measures should building management and staff do to try to keep the area safe for people, because we have so many common areas that we share. We share hallways, we share compactor rooms, we share laundry rooms, elevators. So what preventive measures can the staff that takes care of the building and management do to to help those residents stay healthy and safe?
Yeah, that's a very interesting question. I'm thinking that what you could do is probably, well, certainly what we did early on when this outbreak became identified, which is, and again, it would be somewhat voluntary, but to screen the people that are coming in. And we asked, and we continue to ask, if people that are coming in the building have had any exposure, any known exposure to someone who has been identified as having COVID-19 or suspicious for having that, if they've traveled to those those areas in the world that we know outbreak is very prevalent, and then asking them if they have any active signs or symptoms of a respiratory infection, such as fever and cough, and then asking those individuals not to enter. I'm talking about people going into those buildings, so screening people at the point of entry and asking them not to enter the building if they have those signs and symptoms or those potential exposures. Perhaps at the level of the people that are living there, it's not actually a health care facility, so it would be a little tricky to monitor those individuals, but some system for monitoring and keeping track of people who are sick is probably a good idea. It's a very good question.
Dr. Healy, how much of a challenge is it for you guys to monitor people coming in who have to be there, staff and, you know, just making sure that everybody is safe?
It is a challenge, and we're monitoring all staff every shift as they come in and report for duty, and we are asking exactly those questions. And in fact, we're having them answer it in a written form, and anyone with any potential positive on those screening questions, they are asked not to report to work, and they are referred to their department head to see whether they need to go home and so forth. So it is a lot of extra work, and I think that's one thing that maybe I could communicate to the public, is that it is challenging to work in a nursing home setting. So it's very rewarding, and those of us that do it, we do it because we really want to and we love doing it. But it's always challenging, even under the best of circumstances, and it is particularly challenging in this kind of situation. So maybe just to realize that and to appreciate that the people that perhaps they appear to you to be impeding your access to your loved one, and naturally that is actually what is happening, but understand why, and understand that it is not easy for people that are working in nursing homes now. It's not easy, not having, for example, the families in. They're actually very helpful in terms of keeping our residents engaged. So it is a little more work for us. The constant vigilance, the constant cleaning, the constant rounding on the residents, making sure everybody's okay, making sure the staff is okay, having these meetings, as I'm sure is going on in other aspects of our healthcare system, keeping statistics.
Dr. Healy,
it's
we have to head to a commercial break, but
Sure.
we have more questions for you. We'll talk to you in a little while. Stay with us. Welcome back to tonight's special call-in show. Our guest, Dr. Elaine Healy, who is United Hebrew's Medical Director and the Vice President of Medical Affairs. Again, thanks for joining us.
So Dr. Healy, tell me about the care you guys render, especially during this unprecedented kind of period that we're in right now.
Well, I find that working in a nursing home setting is extremely challenging and very rewarding. We provide care to a wide variety of residents. We have people that are with us for a short stay, who are transitioning out of a hospital on their way back to their home. Those individuals have a certain set of needs that are challenging, and we have individuals that live with us for the remainder of their lives because they have disabilities, chronic disabilities that mean that they require skilled nursing care and observation. And the very rewarding thing that I find as a geriatric physician is the ability to work with a team, an interdisciplinary team, nursing, social work, pharmacists, therapists, dietitians, and to bring our collective skills to bear on making the best plan of care for our residents. And that's what we do all the time. And now we're doing it under rather more challenging conditions than usual. But I must say, the nursing home profession is a very rewarding one, and the individuals that work there are extremely skilled and able to think quickly and react quickly and assess people and situations.
Dr. Healy, I'm sorry, I have to cut you off again.
Certainly.
I apologize. Thank you so much for your time tonight
And for all
talking
you do
about
to the
this most
residents.
vulnerable population.
Yes.
Yeah.
So
Thank
the
you.
conversation continues on Facebook Live, 7:30. We'll do this again tomorrow at 7. Thanks again, Dr. Healy.